You're listening to Heroes of Healthcare, a series about the bold, selfless, and innovative individuals who are serving our communities with compassion and care. This episode is sponsored by Jackson & Coker Locum Tenens. If you are seeking interim physician or advanced practitioner coverage at your facility, or are a practitioner who is looking for more work-life balance, visit them at jacksonandcoker.com to learn more about their services. Now, let's get into the show.
Welcome to the Heroes of Healthcare podcast. I'm your host, Ted Weyn. In our last episode, we had the opportunity of speaking with Dr. David Charles, who heads up the Alliance for Patient Access, which provides resources for patients trying to effectively navigate our health system. Today, we're continuing with the patient advocacy theme by speaking with a dynamic healthcare leader, Leslie Schlachter. Leslie is passionate about the role both the physician assistant and the nurse practitioners play in the provision of excellent care. Leslie has been a certified physician assistant in New York City since 2008. She currently works at Mount Sinai Hospital Department of Neurosurgery, specializing in cerebrovascular and skull-based surgery. She takes care of patients in the outpatient office and inpatient settings, as well as assists in surgeries. She is also the chief PA overseeing over 100 neuroscience NPs and PAs in the Mount Sinai health system. Leslie is passionate about her focus on patient care and the patient experience. She is a member of the hospital's credentialing committee, host of the Mount Sinai Health System podcast, The Vitals, and as we will hear today, a successful social media influencer with her posts on @BrainyLeslie. So let's jump into the show. Welcome to the Heroes of Healthcare podcast, Leslie Schlachter. Thanks for joining us.
Thanks for having me.
Excited to get into today's episode. And I know you have a real interesting background at Mount Sinai and the work that you're doing and some real passions. But I know one of your other passions too, before we get into the medical world, was you were quite the competitive basketball player.
That's right. I started playing late in life compared to other people. I think I picked up the basketball when I was 12 years old, when other people were much younger. I'm 6'4", and I have been 6'4" since I was 13.
Wow.
So I was like 5'9", 5'10" when I was 12 and grew several inches in 1 year. And I'm Jewish, but the local church coach saw my mom in the grocery store with me and said, I want her on my team. And she said, well, she's Jewish. She said, that's okay. And I've played ever since. I played in high school. I played in college at the George Washington University. I was lucky to get a Division I scholarship to play NCAA basketball. And then I played overseas in Israel.
Great. That was probably a great experience to play overseas.
Amazing experience. Absolutely amazing.
Now, was that just a league that was within Israel, or did you travel around the Middle East and Europe, or how did that work?
So I played in the Israeli league, and typically how it works is there's a first, second, and third division. In the first division, which I played in, if you're the top one or two team in that division, you also play in the European league and you travel outside of the country. And my team wasn't. Therefore, all of our games were against other Israeli teams, which was for me just outstanding. I wanted the experience.
Yeah, it is. What a great, and just to be able to live overseas and experience the culture and everything, that I'm sure that was amazing. So, well, thank you for sharing a little bit about that.
Yeah, of course.
I think it's always great to learn a little bit about more of you. So tell our listeners about in terms of what your role is as a PA at Mount Sinai in the surgical neurology group, and what is kind of life there. And then let's talk about a little bit how we'll debunk some of the myths of PAs, right? Which is they're getting in the way, they're not a doctor, all the things that you and I talked about prior to the call. But tell us a little bit about your kind of world right now.
Okay, so I have been a physician assistant for a little over 15 years. I actually got my undergrad degree in marketing and finance, and then went back after my undergrad degree and got my degree in physician assistant studies from Pace University at Lenox Hill Hospital. When I started my career, I started here at Mount Sinai Hospital on the Upper East Side of New York. So I've only actually ever worked at the Mount Sinai Hospital, which is part of Mount Sinai Health System. My career started in urology, specifically men's health and neurogenic bladder. anyone who suffered, let's say, a spinal cord injury and had bladder problems. So I, from the get-go, was pretty specialized in a surgical specialty, which I loved. And then about 8 years ago, I needed a bit of a change and I switched over, which is something amazing that physician assistants can do. We can switch specialties. And I switched to the Department of Neurosurgery. And I currently work as a clinical surgical physician assistant with Dr. Joshua Betterson, who's the chairman of neurosurgery here. And he is a brain tumor and skull-based neurosurgeon. So that is also what I do. I trained with him and his team, and I specialize in brain tumor and skull-based neurosurgery. But I do wear a couple of different hats. Not only am I a clinical surgical PA, I see patients with him, I see patients independently, I assist in surgery or procedures as needed, but I'm also the clinical director and chief PA for our department in the system. So that means I help oversee practice operations. I assist our chairman and vice chairman and administrator with whatever needs to get done for the department. And we also have a very big group of advanced practice providers and nurse practitioners and physician assistants. And I oversee the group at our site and multiple other sites in neurosurgery. So I got a lot going on, a lot of balls in the air at any given time.
I was going to say, it sounds like you're keeping busy. I'm sure there's never a shortage of things to do with all of those responsibilities.
That's correct.
So as a PA in the neurosurgical group, what is kind of the process? Are you kind of frontline? Do you see the patients who are coming in first? Or tell us a little bit about what part of the load of the care you guys are providing are you and the other PAs carrying?
Right. So I think we kind of have to start at the beginning. So for people that work in a surgical specialty that might be listening to this, they completely understand the ins and outs of a surgical department, from the inpatient to outpatient, and what role doctors, PAs, NPs, nurses, medical assistants, what everyone plays. For people that don't work in healthcare, it's actually really confusing and doesn't make sense to anyone. So when it comes to my department in neurosurgery, and honestly, like any surgical department, any department where a patient might require surgery, there are so many steps and so many processes that have to get completed properly for things to go smoothly. So there's really two ways that patients can come into a surgical practice. The first is, and let's just use an example of a patient. Let's say there's a 45-year-old woman who's been having headaches for a couple weeks. The headaches are persisting. So she goes to her primary. The primary says, you're going to go to a neurologist. Maybe you have migraines. Gives the patient a couple things to work on. Ultimately, they go to a neurologist. The medications aren't working. They have an MRI scan. And lo and behold, they find a 2-centimeter frontal lobe tumor. So 90% of the patients that I'm seeing, me in our practice that I'm seeing, are referred from a primary doctor, a neurologist, an ENT, some outside doctor, where they sent a patient for a CAT scan or an MRI and they find an abnormality in the head and they send them to us for a consult. So this is a patient who's walking, talking, moving, functioning, and calls to make an appointment, asks if we accept their insurance, and they make an appointment to come in and be seen. They go on the schedule. Now, that person is panicking because they've had headaches for weeks. They just found out they had a brain tumor. It's not like they have a swollen cuticle that's not healing. They have a brain tumor.
Right.
And so they need the person on the other end of the line, which is my secretary who sits right next to me over here. They need that person to understand that they need to come in and be seen right now. On our end of things, in elective neurosurgery, which sounds nuts, elective, that is crazy. Who has elective neurosurgery?
Right.
So if you are not imminently dying or have an imminent neurologic deficit, it's technically considered elective. Like you're choosing to go there for a consult and choosing to undergo surgery. Those patients typically will get on the schedule within a week or two, and in some places 3. And there's a lot of other places that can be 4 to 5 weeks. So can you imagine being a patient who's had a headache for weeks and being told you're not seeing the doctor for 3 to 4 weeks?
Right.
That's standard. Okay. And we're in a city where we have lots and lots of neurosurgeons. Imagine you're, in the middle of nowhere and the first doctor you're seeing is a general neurosurgeon. And
right. Or you're being referred 100 miles away because there's nobody even in that facility that does that. Right.
Right. So that's the first way a patient will come in. They have a problem, it gets worked up on the outside, and they're sent to us. We are not seeing patients in neurosurgery. They don't call us and say, I have a headache. I'm concerned I have a brain tumor. Can I come in and see it? We can't take that patient. That's insane. That goes to a neurologist.
Right.
Or a primary care.
So you're getting the referrals, like you said, either primary care or from neurology. That's how all the patients that you guys are seeing are coming to you.
There has to be an abnormality in order for us to see us, which is in contrast to a surgical specialty like, let's say, urology or ENT. Somebody can call and make an appointment to see an ENT surgeon saying, my sinuses are bothering me. I want an appointment. Somebody can call a urologist and say, I get up 5 times at night. My bladder bothers me, and they can get an appointment. Could those people end up having something that requires surgery? Sure, but they can just make an appointment. Whereas in neurosurgery, you got to have something wrong. You're not calling with just, I'm concerned. So the second way that you would come in as a patient is through the emergency room. So now let's take that same patient. She's had headaches for a couple weeks. And then today she wakes up and it's the worst headache she's ever had in her life. And now she's having a seizure. So now she's like, oh gosh, something really is wrong. So she calls 911, comes in through an ambulance. They control her seizures with medications, run her through a CAT scan machine. They see a tumor. They run her through an MRI machine. They see a tumor. And now that the headaches are so bad and she's seizing, now she's going to get admitted to the hospital and probably have surgery. So a patient can come in through inpatient setting or through outpatient setting.
And what about head trauma?
Yeah, same thing.
Yeah. Okay.
So, I'm a brain PA, so I focus mostly on brain, but neurosurgery is a mix of brain tumor, benign brain tumor, cerebrovascular abnormalities. There's movement disorders where we have neurosurgeons that do deep brain stimulation, epilepsy surgery. There's spine surgery, minimally invasive spine surgery, deformity spine surgery. And then there's neurotrauma. Walk down the street, get hit by a bus. You slip in the kitchen and hit your head and you develop a subdural. So every possibility exists in our world of neurosurgery for the brain and spine. For physician assistants, and for purposes of this discussion, advanced practice providers is an overall term that's used to describe physician assistants, nurse practitioners, midwives, nurse anesthetists, any sort of nurse or physician assistant that's practicing as a practitioner. And advanced practice providers are absolutely necessary to keep the practice running for surgeons, because guess what surgeons do? They operate.
Right.
They're in surgery, right? So contrary to popular belief of many patients that call our office, they think that the surgeon sits at their desk and returns phone calls and emails. It's actually, so a typical life of a surgeon, and I've worked for a lot of surgeons in my career, 1 or 2 days a week they're seeing patients, 1 or 2 days a week they're operating, and another day is a research day or administrative day. So the surgeon that I work with sees patients on Mondays, operates and sees some patients on Tuesdays and Thursdays. And because he's a chairman, he has Wednesdays and Fridays as his administrative days. So there's 1 day a week where he's not busy.
Yeah.
On Monday, he's seeing patients. He's available. And if there's important phone calls or things that have to get done, they're done. But on Tuesdays and Thursdays, if a doctor calls and wants to talk to him, if there's a patient that's calling that is worried that they have a tumor and want to talk to the doctor, or a patient they operated on and now their sister has a tumor, he cannot return those phone calls. He's in the OR for 8 to 10 hours. So that's where the physician assistants and nurse practitioners come in. So while our doctors are busy operating and busy being doctors, we have to see the patients that come into the emergency room alongside our resident team. Patients that come into the ER are first evaluated by either a resident physician, resident surgeon, or one of our physician assistants. For patients, a lot of patients that come into the practice when they call and want to make an appointment, pretty standard in our practices, they might not get in and see Dr. Betterson for 2 weeks. Maybe his schedule is busy this week and there's not an appointment next week, but I see patients 5 days a week. So that patient who's upset on the phone that they were just diagnosed with a brain tumor, I'll see you tomorrow. Absolutely. I can even see you over telehealth. Let me get you going.
But do you run into that same sort of perception, which is, okay, I've just been told I have a brain tumor. Okay, my world is just now fallen down around me. And I call and they say, great, you can go see the PA. And you're like, no. I need the doctor.
Yep. So, and that's where the calm and the education of our administrative assistants is paramount. So I hear my AAs talk, administrative assistants, I hear them on the phone. And they say, I understand, it's scary. I know you were just told you have a brain tumor. Dr. Betterson might be at a meeting. He might be out of town for a couple of days. He might be busy in surgery for the next couple of days. And they say, I want to see the doctor tomorrow or else I'm going to another hospital. And they're going to get the same answer at that other hospital. And what they say is, Leslie's been a surgical PA for 15 years. She specializes in brain and brain tumors. Her specialty is seeing patients, evaluating them, examining them, reviewing the imaging, and determining what the next steps are. If this is urgent, she is going to get you in with the doctor immediately. If most of our patients require so much more testing before they can see the doctor, before we even know if we're recommending surgery. So once they explain to the patient, don't worry, you are getting your foot in the door. You are going to be in the office with her, and she will walk down the hallway and grab Dr. Betterson immediately if it's an emergency. They come down, and I would say I have a 99% success rate with that. You're going to get the occasional person that says, I'd rather wait 2 weeks and see the doctor than see the PA tomorrow. And that's why having podcasts like this is important. So people learn that we're trained in what we do.
Yeah, and I don't want to put people into buckets, but do you find that person who says, I want to wait to see the doctor, is that an age thing? Is it old people like me who say, I want to talk to the doctor? Or it really is
all over?
It's all over. Interesting. Okay.
It used to, historically, it was kind of the older patient who like literally didn't know what a PA was. I thought maybe they were seeing a medical assistant or a nurse. They didn't understand it. And then I recently had a patient who was a resident in a surgical specialty and probably had a bad experience with APPs, advanced practice providers, and wouldn't make an appointment to see me. And then ultimately, you have to see me when you come to the office. I'm the one doing all the coordination. And then at the end of the visit, apologized that he didn't understand what my role was and felt bad.
So as you said, good to have the podcast, good to educate people on the process and how it works and try to take some of the fear out of a scary situation. So I think you said, so you've been doing the neurosurgery for 8 years?
Correct.
Okay. What did you learn? In other words, that first year you were doing this and now here's year 8 and you're doing this. How has your approach changed? How's your style changed because of,
oh gosh,
you're seeing a lot of people?
So this is where some of the stereotypes are correct. So let's just get this all out there. Physician assistants, I did my undergrad in something not medical. Then I do my post-bac degrees. I do my sciences, biochem, anatomy, physiology, physics, all that stuff. Then you go to PA school and I spend 2.5 years learning the medical model, which is the same model that physicians learn on. But when I'm done with PA school, I go get a job. So if I'm practicing as, let's say, an internal medicine PA or ER PA, I learned a lot of what I need to know in order to be successful from a knowledge standpoint. I learned that in PA school. The amount of neurosurgical knowledge that I had coming into a neurosurgery position that I previously knew was about 5%. So all of these naysayers out there that kind of come down on me in social media or call and say, I don't want to see the PA. In my first year or two of practice, they would not have been wrong. I would not have wanted to see me either. Now, I did have enough. I'm a smart person and I knew what I didn't know. I had access to the right people. So you just get in the door with me. Let's talk through it. And I'm going to tell you, I'm not sure what that is, but I'm going to go get the doctor. So the way it kind of worked for me is my first 6 months or so, I was miserably uncomfortable. I was like, oh my God, this is neurosurgery. People say, well, it's not rocket science or it's not neurosurgery. It was neurosurgery. It's scary.
It is, right.
So I had a steep learning curve where I was uncomfortable every single day because every single day I was learning something I'd literally never heard of before. And I quickly realized how much I needed to learn in order to appropriately take care of patients. And what was great about that time is I was working with our prior chairman, who was a brain tumor and skull-based pituitary neurosurgeon, and my current surgeon. So I worked with both of them. So I was trained hard every day. And by 1 year, I would say I knew enough information to take care of all the basics. And I knew enough about the complex stuff to know when something was an urgency and an emergency and when something was benign and not concerning. However, it took me a full 2 years to be able to make it through the day without asking a couple questions. And so now I would say I felt very comfortable covering for other NPs, PAs, and even other neurosurgeons on an outpatient basis, probably around 4 to 5 years. So it's been several years now that I would say typically I go through a full week or a full month, and I know exactly what I'm looking at. I know the plan. I know what the doctors are going to say. I can schedule a surgery when he's on vacation. I schedule multiple surgeries. The patients are very comfortable. But, once or twice a month, something pops up where I'm like, I don't know what I'm looking at and it doesn't look good. Or what I'm seeing here on this scan does not at all make sense to what the symptoms are of these patients. And I don't know. I'm not sure. So lucky for me, I work in a giant academic institution. Even if someone's on vacation, I could walk out the hallway and yell help right now, and I'm going to have 7 neurosurgeons in front of me.
Well, it's a good reason for those people who are saying, I'm going to go call somebody else to maybe not, because you guys have those resources there.
I have full access at any moment. So it is standard protocol at our hospital that we have a couple different teams. We have our tumor team, our spine team, cerebrovascular team, and our pediatrics team. And somebody has to be here at all times. So, the doctor I work with, he travels, 2 weeks, 2 or 3 times a year. And so I need to rely on these other people. And in under 10 seconds, I can get one of them in my office or on the phone if I'm dealing with a patient and I know something's wrong. So that's what I think a lot of people out there who say, PAs are taking over for the surgeons. I don't want to see a PA. I want to see the doctor. You are. I literally cannot practice neurosurgical medicine without a surgeon. That's insane. Like, I need them. I'm just the gate to get in.
So you hear that obviously from the patient side, and obviously the surgeon you support now I would highly assume he would say, I can't do this without Leslie, what I do. But there are some doctors who are saying, oh, they're giving too much authority to the PAs. And there are people who seem to be concerned about the role of the PA. Is that just an insecurity or?
No, it's an insecurity and it's real. So if the doctors all of the surgeons here that I work with, if you asked any of the neurosurgeons in my institution or in the greater New York area, like what their thoughts are about me, they would all say that they trust me. They trust me and they're comfortable having me following their patients. If you had asked them that in my first year or two here, they would have been like, nope. Like, she comes to me every day with a question. Like, why would I? So a well-trained veteran surgical PA is a completely different breed than a brand new graduate physician assistant who's just learning. But unfortunately, we're all PAs, so we're thrown in the same bucket. And it's the same concept of, not just because someone's a doctor doesn't mean they're outstanding. There's a lot of bad doctors out there. There's also a lot of great doctors. So and no 2 physician assistants are created equal. So my level of knowledge and what I am good at and know how to do is vastly different than a vascular surgery PA or an orthopedic PA or an emergency room PA. If you put me down in the ER, I'm confident I would fail.
But I guess then, to your point though, going back to that panic call, right? It would be okay if I were making the call and they would say to me, you're going to see the PA and that's what you do first. And I would say, it's okay for me to say, well, how long has the PA been doing this? That might not be that could be a fair question, right?
My AAs generally say that up front. So we have our chief PA, Leslie Schlachter, specializes in brain tumor and skull-based neurosurgery. She's been doing this for well over a decade. She is Dr. Betterson's right hand. He trusts her to get you in and get everything evaluated and order any testing and scans that needed to get done. So a lot of our patients have a tumor called a pituitary tumor. And pituitary tumors could easily be surgical or not, and some require medications. Most of the patients that come in the door are not properly evaluated. So they might have had a CAT scan or an MRI scan. And I don't know if they're going to require surgery or not until I have them see an ophthalmologist to do special testing and to get endocrine testing. So as much as I'd like the referring doctor to know how to properly send a patient to me so that we can give them that surgical, it just doesn't happen. So the first visit or 2 is sometimes making sure all of that gets done and that they're stable.
Right. And a lot of times when you're looking at the referral documentation, is that assessment of the tumor or pituitary, whatever it is that coming from the referring doctor or from the radiologist or both?
It's usually never coming from the radiologist.
Okay.
It's coming from the referring doctor or the patient themselves. So the referring doctor, it's interesting, since COVID, there's been a huge change. Prior to COVID, most of our referrals came from the referring doctor, someone who found the lesion and now they're calling because their doctor said to come see us. Now, since telemedicine is so popular, we are getting phone calls from all over the country, all over the world, for people getting second, third, fourth, fifth, sixth opinions because they can.
Okay. Okay. Interesting. So you mentioned earlier, and talk a little bit about how you've used social media. I think I saw on Instagram you have like 23 or 28,000 followers, and you've kind of created a little bit of a brand. Why and how has that benefited for you in the work you're doing?
Right. So in 2016, 2017, our director of marketing came to our department and said, the hospital wants people out on social media to start working on branding and marketing. It would be really great if you guys could have a social media page. And immediately the doctor I work with was absolutely not. I'm not going on social media. Leslie will do it. So I had my meeting with our marketing person and I said, you know what? It's very fitting of my personality. I love Instagram and all that stuff. I'll do it. But I need it to be authentic for me and what I care about. I can't have it just be like an advertisement for Mount Sinai Neurosurgery.
Right.
Even though I love Mount Sinai Neurosurgery and I bleed blue and pink, which are our colors, but that's just not, I wasn't going to be successful if that was my goal. The same thing that I'm talking to you about today is what my goal was for my Instagram page, and it's been successful. The first is to make neurosurgery something understandable and tangible for the patient. So I wanted to be able to educate the patients who need our help and either get them to us or get them to the right neurosurgeon. So no neurosurgeon is created equal, just like lawyers. You're not going to go to a divorce lawyer if you want to work on your last will and testament. You're not going to go to, if you're being convicted of murder, you're not going to choose a divorce lawyer. Same thing. If you need a brain tumor surgeon, you're not going to go to a spine surgeon. So I wanted to give that information properly in an easily digestible way, which for me has been Instagram. And then the second thing is we talked a little bit about like, are all PAs created equal and what does that mean? And are they taking jobs away from doctors and what does that look like? I want people to really understand what a physician assistant or an advanced practice provider is. I want them to know that like we can be specialized in what we do. We can help people. And for those who are scared of working in a surgical specialty, it's actually with the right training, anyone can do it. So I was terrified of the thought of working in neurosurgery when I was in PA school. I would have said that's the only specialty I wouldn't have worked in. And now that I've worked in it and I'm around the right people who I've been trained properly, I want to share that with other people who might be a little scared and I want to help them. And I have. Over the last 5 years, we've operated on well over 100 people that found us through my Instagram. And I've hired about a dozen people directly from Instagram.
Wow.
Yeah. So
that's great.
It's great. It's a great tool.
And do you create like one source of information and then distribute it on the other platforms? Because I see you're on TikTok and Twitter. Well, now it's X and some of the others.
I don't really connect well with X. It's never really been I don't love scrolling and connecting with other people on X. It doesn't fit my personality and what I'm looking for. I'm just sort of there. I actually had an account several years ago that had almost 20,000 followers and it was hacked and deleted. And since then I was like, you know what? I'm just going to let that one go.
Oh gosh.
And the truth is TikTok is perfect for me and my personality. Although I work in a very, very serious specialty where I have patients that are diagnosed with cancer and I know they're terminal. I do very scary things where people die. My personality is to care for them with calm and love and humor, which usually doesn't go over well on channels like X, but on TikTok it does, but it rubs people the wrong way. So if I were actually truly myself, might really upset a lot of people on TikTok. So Instagram for me kind of like goes down the middle a little bit where I can be fun and educational at the same time.
No, I think it's great to use that medium. And like you said, people are finding you, and if they can watch 2 or 3 or 4 of your streams and feel better or less panicked or feel like they get some information, it's great. And we live in not only do we live in a digital society communication, but we just kind of live on bite-sized pieces of information. The internet is a scary thing. If I Google brain tumor or I Google, any of that sort of stuff, I can get a lot of misinformation. And so to have a resource like you bring on that is great. And obviously it's having continued results that way. So
It's also a very dangerous place, right? So I get hundreds of DMs every week. There are people that want to come shadow me or they want to come learn here, which is great. But I also get people who are looking for medical information that get upset when you don't answer them. And that's not what that platform is for. I'm not a free medical service. And that's dangerous because if you're not my patient, I'm not seeing you and evaluating you and I'm giving you advice, that would be crazy for people to do that on a social media platform.
right.
But you have to have a pretty hard skeleton to be on social media because there are a lot of trolls and angry people out there that are only looking to hurt you and bring you down.
Yeah.
I recently posted something that went viral. It got 1.4 million views in a couple of days. And it was a really kind of kitschy video of me and Dr. Betterson. And people were saying, it looks like you didn't get his permission for it. And I was like, not only did I get his permission, he loved it and thought it was great. But people said it was cringy and it was a terrible post, but they didn't get it. They obviously didn't read what I wrote or view it.
Yeah. But isn't it sad that the perceived bad post is what goes viral?
Yeah.
The best educational one you've done gets views, but the haters are going to hate, right? So the bad one goes viral.
They hate it so hard. And everyone assumed that I was posting that saying that I'm great and I'm amazing, when in fact my post was, I'm so proud to be where I am because I have him.
Yeah.
But they didn't get it. But joke's on them because it was viewed 1.4 million times and I gained an additional 2,000 followers from it who now want to see me because of my content.
Right. Well, sometimes they say, right, there's no such thing as bad press or, bad exposure. So, well, that's good. Yeah. So now you're getting reach out to further people. So, well, that's great. Appreciate it. Well, thank you for spending some time with us today to talk about the role of PAs and neurosurgery and that process. And hopefully that will continue to get your message out. And some people will listen to this and unfortunately may be in a situation where they can help out a friend or somebody who's going through some bad news, but give them a little bit of peace of mind, so to speak, of how the process works and how they should feel comfortable with an experienced PA holding their hand through the process.
Yeah. And people should know that it's just like you would ask a surgeon if you're getting ready to have a hip replacement. I would hope the patient would say, how long have you been doing this? How many have you done?
Right.
It's okay to say the same thing to a PA. If they're nervous about seeing a PA, how long have you been doing this? How many patients like me have you seen? I would want someone to ask that. And if the answer to that question is, I just started last week, I think it's probably okay that you're a little nervous about seeing them.
Sure. Absolutely. It's with a lot of things in life, but nothing can be better than experience. And that's what comes down to. And you can read all the textbooks in the world and then you go and do it and you go, wow, this is nothing like I thought it was going to be. And that's just kind of how life works with everything. So we always try to end our shows with my famous question, I guess I should say, or our famous question, which is, as part of the Heroes of Healthcare, who was your hero?
My hero is my mother. Growing up, your mom is kind of makes you nuts and you don't want to be anything like her. You don't want to spend time with her. But my family and I went through a tragedy 20 years ago. My sister was murdered. And the way that my mom handled that and is recovering, she now runs the Happiness Club for the state of Connecticut. She helps other people who have lost children. And she is a staunch advocate for people going through what we've gone through. So she has really made lemonade out of lemons. And she is a prime example of you can make your own happiness. We all have reasons to complain or be a little cranky some days, but instead of focusing on those, she's taught me to focus on all the things that make me happy. And just to kind of tie it all into my practice as a PA, It would be really easy to say how much I love my job when we help people and do amazing things. I love that. I love when someone comes in who's going blind from a tumor and they get their vision back, or someone's paralyzed from a tumor and then they walk again. That's amazing. But that's a win. That's an easy win. But what's also something that makes me happy that I can do is not everything goes well. There are people that die and there are people that we can't help. And being able to be a part of that experience and make it any bit better is an honor and a pleasure for me. And so I always try to find happiness in everything that I do and try and find that for other people too. And I definitely learned that from my mom.
No, that's great. Yeah, I love the expression choose joy, right? It is our disposition in life is a choice. We can choose to be a victim or we can choose joy. And I'm not saying it's easy, but it is a choice that we have. And I can see why mom's a hero and having done that. And obviously, I think it reflects on you because you're taking that attitude into what is at times a difficult situation, but it shines through and you are a bright light in the PA world. So thank you for what you do.
Thank you. Thank you so much.
Well, thanks for joining us. We hope to have you back again and we'll continue to stay in touch. And thanks for being part of the show.
Of course. Happy to be here.
You've been listening to Heroes of Healthcare. If you enjoyed today's episode, please tell a friend or leave us a review wherever you get your podcasts. You can also visit us at www.heroesofhealthcarepodcast.com for more information or to listen to past episodes. Thanks again to our sponsor, Jackson & Coker Locum Tenens, providing interim physicians and advanced practice staff for over 40 years.